fifth generation in Ballarat. Got another one here, so we just chose with the foundation to structure it to give to the Ballarat community. Ballarat Health Services is one of 5 or 6 organisations that we have helped over the last 12 years. I did have cancer myself, and one of our first donations in the foundation was to Ballarat Health Services to get it up and running. The Oliver Foundation was pleased to get involved with Ballarat Health Services when they were setting up their new children's ward, and we managed to donate quite a few different articles for them to place in the wards. The foundation was lucky enough last year to have the opportunity to donate to Ballarat Health Service a neonatal ventilator for tiny babies, with the hope that they could be used in Ballarat and not being sent to Melbourne.
So my name's Luke McElderry, currently the acting of the kids ward, so the paediatric and adolescent unit. My ongoing role is in special care nursery as the nurse unit manager. The Neopuff that we, as we refer to it on the ward, is an emergency piece of equipment. It's designed for resuscitation of newborns, so bubs from birth up until sort of around about 3 months of age, and it is essentially a respiratory support device. It's primarily used in the setting of a premature baby with premature lungs that aren't quite developed to the point of being able to independently breathe. So without the infant resuscitator, we would have used a bag and mask, it's essentially like a balloon attached to a mask that you manually just breathe for the baby. The risk with that is that we have no idea what the pressures are doing, and so there is potential that you could do damage to the lungs, cause pneumothoraxes, whereas there's a safety function in the Neopuff that means that we can't exert that amount of pressure. But one of the great things about having the Neopuff so readily available is that it minimises the transfer of families from a regional setting to a tertiary setting in Melbourne. So it's keeping families together and giving care close to home. Your generosity and ongoing support means that with acquisition of devices such as an Neopuff, we can safely, efficiently care for the youngest and most vulnerable patients within our community, keeping them close to home at Grampians Health with the support of family and friends.
The foundation thought it was an excellent idea. Ballarat Health Services was the only hospital between the two that has a children's ward, and we just felt it was necessary to donate some new facilities for the new ward.
So this is the Belmont Rapid Infuser, and it expertly and precisely infuses blood and fluid products at a rapid rate. We are able to replace lost fluids in patients really quickly. This piece of machinery is beneficial to us because it is quick to set up. You can deliver a litre within a minute. The times that you deliver the fluid are variable. It's very easy, quick push of the button, variable flows. It heats up instantaneously and keeps the patient normothermic. We can move this piece of machinery from department to department with ease. It really is an invaluable piece of equipment that we can use across a range of departments at Grampians Health Ballarat. Thanks to your incredible generosity of donating this Belmont, we are able to deliver safe patient care, which is of great reassurance to all the staff that work here at Grampians Health Ballarat. And we thank you very much for enabling us to deliver such expert care in a regional facility.
The foundation was lucky to see 3 or 4 of the donations being used. Certainly one that comes to mind is the technology that we donated to recreate arms, legs or amputations. One particular fellow just had his new leg fitted. The joy of him having 2 legs now was a sight to be seen.
The donation has allowed us to purchase a 3D scanner and scanning software, and we've been using that 3D scanner at the moment to scan for lower limb orthoses or braces, so maybe for people who've had a stroke, for children who have cerebral palsy or someone who's had a spinal injury or something like that. We're also using it to scan the stumps of people who've had a below-knee amputation to make prosthetic sockets, and also for babies who have a really misshapen head. They need what's called a cranial remodelling helmet for a condition called plagiocephaly, and that's been really beneficial as well. Your donation means that patients of Grampians Health now have access to the latest cutting-edge technology, meaning that we can take 3D images of those patients to creating devices using 3D carving and eventually, hopefully, 3D printing. But we'd love to do that in-house to make the process for patients all accessible at Grampians Health.
Our foundation sits down and tries to access as many donations, suggestions as we can. We've tried with our foundation to support the medical facilities because it is so important for so many people. I think philanthropy is important and should be seen as a way to help as many people as you possibly can. On a personal side, I think it makes you feel good if you can do some good to the community.
We use the patient monitoring system to monitor our patients' vital signs, which can include their heart rate, their rhythm, their blood pressure, as well as their respiratory rate and oxygen saturations. Before we used the Philips patient monitoring system, it was quite difficult to troubleshoot if we were transporting a patient from the intensive care unit to our cath lab or to our radiology unit, but now we can do that seamlessly. We now don't have to select which vital signs are the most important to us. We can have all of them going at the one time, and that helps us stay in control and understand what's going on with the patient at all times. Your generosity towards Grampians Health Ballarat means that I can detect clinical deterioration very quickly and respond appropriately, as well as all the other nursing and medical staff. We can act quickly to give the best possible care to our patients.